Welcome to this episode of the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. I'd like to thank our host, Gretchyn Bailey, our topical expert, Mo Rafieetary, and editor Andrew Rixon for today's episode entitled Consequences of Lapses in Treatment with Vascular Endothelial Growth Factor Inhibitors in Neovascular Age-Related Macular Degeneration in Routine Clinical Practice. It's my pleasure now to begin today's broadcast.
Hi, everyone. I'm Gretchyn Bailey, and I am a fellow of the American Academy of Optometry. And today I am joined by Mo Rafieetary, who is also a fellow of the Academy, and he is chair of the Retina Special Interest Group. He's also part of a retinal practice in Memphis. Hi, Mo. Thanks for talking with me today.
Hi, Gretchen. Thank you. Good to be here.
Well, today we're talking about an article titled Consequences of Lapses in Treatment with Vascular Endothelial Growth Factor Inhibitors and Neovascular Age-Related Macular Degeneration in Routine Clinical Practice. This is by Greenlee and colleagues, and it appeared in the March 2021 issue of Retina. And this retrospective chart review looked at outcomes in patients receiving anti-VEGF treatment for neovascular AMD who experienced a lapse in their treatment. What did these results show?
Well, basically, Gretchen, this results showed that something that was intuitive to us, and we understood this, that when you have lapses in treatment for neovascular AMD, the consequence is loss of vision for patients who are lapsed. AMD, neovascular AMD is a chronic disease and require continuous treatment. And we know from clinical trials, from real-world data, the more treatment the patients get, the better they retain vision. And in some instances, their vision improves. With lapses and reduction of frequency of injections, patients do lose vision.
How important is follow-up in treating patients with AMD?
It's extremely important. I mean, these patients, again, even if they're not treated and we go on what's called the PRN sort of treatment method, you still have to monthly or every 5 to 6 weeks watch these patients because there's high rate of reoccurrence of neovascular membrane. When it goes to regression or a remission, it has a high frequency in macular degeneration patients. Choroidal neovascular membrane and other conditions behave differently than macular degeneration.
So getting into specifics about the disease, how quickly can it cause damage to patients?
So, and that's an excellent question, but it's somewhat of an unpredictable finding because, again, within even AMD patients, there are different types of choroidal neovascular membrane, and some of these are more aggressive than others. Some of these have, and it all depends on where the epicenter of that membrane is, how it evolve, and many other factors that we probably even still don't know. So it's really hard to tell how quickly one of these can cause major damage. But we know for sure that if they're neglected, they result in poorer outcomes.
So why is this study and its results important to optometrists?
I can, and that comes from experience because I'm in a practice where we see a lot of these patients who month after month come to our clinic, get injected. They may have some skips in injections because we look at them and say, you're doing okay today, go and come back in 5 weeks. There are sometimes these discussions that my other eye doctor said, when you're done with me, then I'll go back and get my glasses. Or when you're done with me, I'll go do. We're not done with these patients. This is a chronic disease, and our colleagues that are in a referral mode and they're sending these patients and have better sort of relationship with these patients should re-emphasize that. This is a treatment. You may want to see your patient from time to time yourself, but then you have to give that message to these patients that they're dealing with something that's in some cases lifelong.
Well, Mo, thanks very much for talking with me today about this article addressing the consequences of lapses in treatment for patients with AMD. Thank you.
Thank you, Gretchen.
And a special thanks to CooperVision for their educational grant to make it all happen.